name's Andy Fleck. I'm a physical therapist at the Fulton County Medical Center. This is Melinda Brown. She's a physical therapist assistant. And this is one of our LSVT Big patients, Paulette Brown. She went through the program a couple weeks ago. So we just wanted to talk to you briefly about Parkinson's disease, the LSVT Big program, and how the LSVT Big program can benefit you if you have a diagnosis of Parkinson's disease. So Parkinson's disease, it's a neurological condition that often affects the movement system. So usually what we see with Parkinson's disease as the disease progresses is that we see smaller movements, we see slower movements. We see when we're walking that we tend to shuffle or our arms aren't swinging quite as much when we're walking. So LSVT Big really hones in on these deficits, and it's right in the name. It's a focus on big, large amplitude movements to kind of compensate for those small movements that take over when somebody is diagnosed with Parkinson's disease. So we're going to do a quick interview here with our patient, Paulette Brown, who went through the program, and she's just going to kind of tell you how the program went and what benefits she saw.
Paulette, how did you first hear about the program and what made you decide to participate in the program?
Well, I asked my doctor about if there was a program to slow down the Parkinson's progression, I guess. And so he said, probably apply at your local hospital. So I came to Fulton County Medical Center and they said that they had this big program. So then I talked to Andy and they said that I have to be evaluated. So from that, I went into the program.
Okay. What signs and symptoms did you have in the beginning that made you seek medical attention? Did you have any shuffling gait? Did you have trouble getting out of a chair?
Mostly it was a tremor in my right hand that I first noticed, the shaking, and that's when I went to the doctor and I was diagnosed. I didn't have any shuffling, or sometimes I have trouble getting out of a chair, but I think that's just old age now.
Did you have any trouble or any issues with your voice or with your speaking? Because we do offer what they call a loud program that is part of the LSVT program.
No, I haven't had any trouble with that speech or anything like that.
Okay. Did you notice, or did a family member notice that you didn't swing your arm when you walked?
A family member, and then I noticed, and then when I had my rotor cuff surgery, you guys noticed that I would curl my hand or didn't swing it. And I still have problems swinging my right hand. But it's better now, I think, than it was.
Okay, good. How did you feel when you were participating in the Big program, and what did you enjoy most out of the program?
Oh, I enjoyed the program. I thought Andy and you were very good at making me do what I had to do. And I really enjoyed the program. I thought the progression of the Big program helped me with my movements and getting around and, using my muscles, I guess I want to say, to help slow down the Parkinson's disease. No, I thought it was I enjoyed it.
Would you recommend the Big program to anybody else who was diagnosed with Parkinson's, or to a family that knew a family member was diagnosed with it?
Very much. I would really recommend it. I think it was a good program.
So if you find that you've been diagnosed with Parkinson's disease, or if you have a loved one, or you know somebody who's diagnosed with Parkinson's disease, you can ask that person or talk to your doctor about maybe getting a prescription for physical therapy specifically for LSVT Big. And we can see you right here at the Fulton County Medical Center. Again, both Mindy and I are both certified in this program, and we're happy to help you.